There's a real art to interacting with patients, and particularly someone who's come into the hospital with a cancer diagnosis. The level of anxiety is, of course, very, very high. So the first thing is to acknowledge them as a person and to acknowledge the anxiety and to let them know that you're there to help and to be truthful. Patients want someone who understands the type of cancer they have from one end to the other and really knows what's best for people with that particular type of cancer. And increasingly, that requires people with multiple specialties. Another factor is that as we learn more about cancer, we're learning that two cancers that seem identical on the surface are really very different. So two breast cancers that look the same under the microscope and on the mammogram may have very different molecular makeups and require very different treatments. We need to be able to do patient care, we need to be able to do research, and we need to be able to do education. And none of them stand alone. So my real passion is looking at the synergy between those three missions and making sure they're all mutually supportive with a focus on the patient. One of the greatest pleasures of my job is getting to work with the incredible people I work with on the clinical area and the research area administratively. They're all passionate, they're all dedicated, they all bring a unique skill set. And bringing these teams together and accomplishing things that none of us could accomplish on our own is really what drives me every day.